New at 5, Emory University is preparing to lead a program mailing out free HIV self-test kits nationwide.
So this is a plan right now to mail 1 million tests over the next 5 years. This will be the largest program of its kind. And 11 Eye Joe Hinkie talked with the director about the program today. So this is similar to the COVID-19 tests that we've all probably received in the mail.
Well, that's right, Ron. People should be familiar with these tests, or at least comfortable with them, because on the surface it is very similar. You get your results in around 20 minutes. Thankfully, with the HIV test, you swab the inside of your mouth, not your nose, so a little bit more comfort there. But the main difference, COVID-19 tests are meant to be used in response to an exposure or symptoms. The goal with mailing HIV tests is to help people begin routine testing.
This is really about increasing the scale up to this nationwide distribution. So not having it just in some states and not others, but really for anyone, anywhere.
Dr. Travis Sanchez with Emory University's Rollins School of Public Health is executive director of the program Together Take Me Home. Starting this upcoming spring, it will begin mailing nationwide 1 million free at-home HIV tests over 5 years. In 2020, Emory ran a similar program at a smaller scale. CDC data shows 36% of that program's participants had never been tested for HIV, and some then sought out further HIV prevention or treatment.
So there's an entry into this routine testing pattern with really the ultimate goal of trying to have people thinking about HIV testing as a routine part of their health care.
The CDC recommends everyone 13 to 64 should be tested for HIV at least once as part of routine health care. People with increased risk factors should be tested annually. Sexually active, gay, and bisexual men could benefit, the CDC finds, from testing every 3 to 6 months. The tests that will be mailed out by the Emory-led program are from OraQuick. These tests have been used for several years, and FDA data shows they are very accurate, with an expected performance rate of 99.98%, meaning one false positive out of every 5,000 tests. The tests will be available nationwide, but could have a great impact on states like Georgia, which in 2020 the CDC found had an HIV infection rate of 22 cases per 100,000 people. Only Washington, D.C. had a higher rate.
What we think is in these communities that are very highly impacted, like Georgia's, that there may be people who need these services but aren't accessing them. And so we hope that this will fill that gap.
And Dr. Sanchez says for people at higher HIV risk, he hopes easy access to testing will lead to routine testing. If someone tests positive, they're directed to then contact their doctor for an in-office test to confirm their status. Again, these free tests will be available starting in the spring. Ron, Jennifer.
Okay, so we know that the CDC is going to fund this thing for the next 5 years, but what happens after that?
Well, Dr. Sanchez tells me their 5-year investment here shows that they're very serious about making testing for HIV accessible to everyone. So he's hoping within the next 5 years they can find permanent funding so this can continue on into the future.